I think it's really interesting that women make 80% of the healthcare decisions for their family. We've had this discussion in senior staff, and the question comes up, why? Why in this day and age where we know so many women are working, are they still the primary person responsible for healthcare decisions in their family?
We know our family schedules, who is going where and when, if there's soccer practice or piano lessons or art classes.
There are a lot of challenges associated with that. I had 3 children, so trying to get in to see providers at a time that would work for the kids as well as for myself was always a challenge.
You know, I'm very often asked what particular skills do women bring into the healthcare arena. Leadership is best handled by a wide variety of people. It can be male, female. I still find it interesting that when people from the outside come into our senior staff meetings, and we have about 50-50 male and females, they always feel that it is overwhelmingly female. And I tell them this is what a 50-50 organization looks like, because they've really never experienced one where there will be that many women represented in, you know, the C-suite.
I would say for women, as leaders within an organization, it's important to have their feedback of what they're experiencing in their home life and be able to bring it to work and be able to provide programs and delivery of services in a way that would best be acclimated to the families that they are serving.
I think going forward, all of us are going to be held much more accountable for taking care of our own healthcare needs. People are actually going to assume, I think, appropriate responsibility, probably really be more cognizant of what their blood pressure actually is and take some responsibility for managing that.
Well, and I think along with that, the healthcare system in general has moved more from taking care of sick people to how do we keep our community healthy? How do we educate people on the appropriate ways to stay healthy and avoid illness?
And I think that is one thing that makes our system very strong, is that we have been focusing on these preventative strategies for a long time, through the obesity clinics, through the children's programs with the fitness centers, through mental health first aid with Linden Oaks.
One of the really wonderful new services that we've started at both Edward and Elmhurst are the walk-in clinics. That's one of the innovations that wasn't available when I had younger kids. You had to really try and schedule an appointment, take time off work. They didn't have walk-in clinics, and I think those make a huge difference.
We've also started iChat, where individuals can go online and begin sending in a text message to our resource and referral department, and then we can coordinate care back with that individual as well to either come in for an assessment or give them an appropriate referral as well.
The other thing that I think we've done to make it easier to use our system is the online access to medical records.
We have this virtual electronic medical record with Epic. If you're seeing multiple providers now, they are able to easily access your information and share it amongst each other so that you can get the best care provided to you as a patient. And I think this is what's going to help women as caregivers to really coordinate the care for themselves and their family as well.
And I think we're just really seeing the beginning of how advances are going to just continue, probably even more rapidly in the next 10 to 20 years.